Okay, so today I'm going to be going through some of Chapter 8, Chapter 9, and Chapter 10. I'm not going to go through too much in Chapter 7. You guys can review that chapter on your own. There's a lot of A and P in there, and you guys can do that on your own. I just wanted to really touch and draw your attention to some important things in these three chapters that I thought you should know. So we're going to start off talking about the placenta. So obviously the placenta is an essential part of fetal development. The placenta provides the oxygenation for the fetus. It provides all of the nutrition. It provides for waste disposal, the hormones that the fetus needs while it's growing, and also protects the fetus. So it's very, very, very important part of the fetal development. Next, we're going to be talking about the umbilical cord. So it's usually in the center of the placenta, but that doesn't mean it always has to be there. This is basically the baby's lifeline. This is what transports all of the oxygen, the nutrients to the fetus, and also removes the waste from the fetus. There are one vein and two arteries after the baby is delivered, and they cut the cord. That is one of the things that they are looking at, because that can kind of give us an idea if there's been anything wrong with baby's development. Because if they don't have those three structures inside the cord, there could be a problem with certain organs like their kidneys. Wharton's jelly is a connective tissue that protects the umbilical cord from being compressed. So if you were providing prenatal education to your mom, that is definitely something that you would want to explain to them, because a lot of times they hear a lot of horror stories about, the baby's cord being clamped off, and once that happens, then the baby doesn't get oxygen. So you would want to help to relieve some of those anxieties by letting them know what that is and what it does. Okay, so next we're going to talk about the purposes of amniotic fluid. The amniotic fluid provides protection and cushioning for the fetus. It helps to maintain the normal body temperature of the fetus while in utero. It actually has some effect on the growth of the fetus, making sure that they are growing symmetrically. Provides freedom of movement for the fetus while they're in utero. Prevents the amnion from adhering to the fetus. There is a sac there that you wouldn't want to adhere to the fetus. It's also essential for normal fetal lung development. So the amniotic fluid is just as important as the placenta when we're talking about fetal development and growth. The amount of amniotic fluid is important. If there's too little fluid, there could be something wrong with the baby's development. So that's important for them to know, and as well as being too much. Think of your homeostasis. You want to stay in that happy place, and amniotic fluid volume is no different. So a normal amount would be about 800 milliliters by the time the fetus is 24 weeks gestation. The major contributors to the amniotic fluid are fetal urine and lung secretions. The amniotic fluid also contains some antibacterial and other protective substances inside of it. Okay, so now we're going to talk about some threats to embryonic and fetal development. Chromosomes, think about Down syndrome. It's not good to have extra chromosomes, and it's not good to have enough of certain chromosomes. But some congenital defects can occur, or genetic defects rather, because of chromosomes. Teratogens, those are things like chemicals, toxins, infections, medications, drugs, tobacco, alcohol. Those are all considered teratogens. Torch infections, so the T stands for toxoplasmosis. That's why we tell the moms not to empty the cat box, because cat feces does contain the toxoplasmosis bacteria. The O stands for other, which could be things like hepatitis B, syphilis, or chickenpox. The R stands for rubella or German measles. The C stands for cytomegalovirus, and the H for herpes. Other threats to embryonic or fetal development could be maternal age. If mom is too young, she is still growing herself, so that could be a threat to the developing fetus. And also if the mom is of advanced maternal age, and generally they consider that to be over the age of 35. Now, to me, I don't like to say that they're of advanced maternal age. That really makes them sound old. But as you know, women tend to delay pregnancy nowadays until they are at a certain point in their life where they feel they're ready to have a baby. Also, the environment that the mom lives in, and I would think this would be like if she's in a poverty situation, if she lives in a dirty environment, if she lives in an environment where there's a lot of people living with her, that increases her risk of being exposed to different infections. So when you're thinking about threats to that fetal development, those are the main considerations that you want to be thinking about. Okay, so now we're going to start with Chapter 8, and we're going to talk a little bit about some of the physiological and psychosocial changes that the woman can expect during pregnancy. If you are working with this population, you want to be providing them with anticipatory education. In other words, you want to prepare them for what they can expect. Now, this doesn't mean that all of these things will definitely happen, but it is a possibility. And some of these things they will experience throughout their pregnancy. So it's going to be very important that they understand this and are aware of what these things are so that they don't get concerned if these things do occur. As we all know and have heard throughout our lives, there are a lot of hormones that are secreted throughout pregnancy. Sometimes it makes the woman become really emotional. And two of the major ones are estrogen and progesterone. So some of the things that estrogen is responsible for: breast tissue enlargement. The breasts do enlarge throughout the pregnancy. Uterine tissue enlargement. Remember, the uterus needs to grow as the fetus grows. And it also needs to be contractile, right? Because that's part of the labor process. They need that contraction, that squeezing for the baby to be able to be born. Progesterone, slowing of the GI tract. This is really what contributes to some of the GI symptoms that the woman may experience because their GI tract actually slows down. Relaxation of the uterus and all smooth muscle, again, because of that growth. And vasodilation, which increases, and they also have increased blood flow. Remember, they do increase their blood volume and their cardiac output during pregnancy, and we're going to talk a little bit more about that in a little bit. Okay, so one of the things that we definitely want to be educating our moms about are Braxton Hicks contractions. This is commonly known as false labor. So with Braxton Hicks, they are irregular. They're not really as painful. They prepare the uterus for the labor process. So they do actually have a function. They usually don't last very long, usually less than a minute. And they can usually be resolved if the woman gets up and walks around. But if she is experiencing these and they start to become more regular, she can time them every 5 minutes or every 10 minutes or what have you. And if they're associated with other symptoms, you want to make sure to educate the mom about coming in to the emergency room right away, because it could be true labor rather than false labor. And the difference between true labor and false labor really comes down to changes in the cervix. That's really how you know that the woman is actually in true labor. Some integumentary changes that the woman may experience: hyperpigmentation. They can get discolorations to their face. They call that the mask of pregnancy. They can have different discolorations to the palms of their hands, as you can see in that picture up above. The stretch marks that they can experience, they can have them down towards their pelvic, in the lower pelvic area. Those obviously, they don't go away. That you can tell them to use cocoa butter, but sometimes once you have the stretch marks, you're stuck with them. The linea nigra can be the line. It's a brownish discoloration that goes along the abdomen all the way down into the pelvic region. Some of these changes are not really very attractive, but some of them are just temporary. So you want to make sure you're letting these women know that they're not permanent, although, again, stretch marks can be. Okay, so as far as the neurological system is concerned, there is such a thing as pregnancy brain, and really what that means is sometimes these women can have memory lapses, they can have a decrease in their attention span, and they can have poor concentration. If you've ever watched any movies where they have a pregnant woman, you know, they'll usually make some reference to pregnancy brain, and that's why they kind of act a little goofy. Okay, I wanted to definitely touch base on supine hypotension versus orthostatic. The positioning of how mom lays when she is supine is very, very important, and this is very important as she gets into the third trimester, as the uterus is enlarging and as the fetus is growing. Supine hypotension is related to pressure that is exerted on the inferior vena cava. This impairs venous return from the lower extremities, so that can cause the blood pressure to drop. So as she progresses through her pregnancy, when she gets into that third trimester, you need to be educating the moms to be laying in their left lateral side position. That's going to definitely go a long way to preventing this problem. Orthostatic hypotension, stagnation of blood in the lower extremities. You want to make sure to educate the moms about rising slowly when they're laying down, that they get up slow, you know, sit for a couple of minutes, make sure they get their bearings, and make sure that when they're up and that they keep their feet moving. You don't want them to, you know, just stand still for too long, because they could end up with a drop in their blood pressure, get very dizzy, feel faint. As I mentioned very briefly earlier, they do have an increase in the blood volume, 40 to 50% related to plasma and erythrocyte volume. The first 3 days postpartum, they do have a diuresis that they go through, and this is related to the decreasing of the blood volume. In the third trimester, they will have a physiologic anemia. That is very normal, and that is nothing to be concerned about. The hemoglobin can be between 11 and 12, which for a female is definitely considered anemic. We want to make sure that we're maintaining their hydration, because that's going to help with their blood volume. We want to make sure that we're educating them about a diet high in protein and iron. Part of the prenatal vitamins that we want them to take contains iron, and they may even have other, you know, supplemental iron that they may want them to take, especially if mom has an iron deficiency of her own. Cardiac output increases 30 to 50%. The pulse rate can increase anywhere between 10 and 15 beats per minute. They do have vasodilation, as we talked about, from the progesterone, which reduces blood pressure. Remember, when the veins dilate, it can drop the blood pressure. Increased fibrinogen volumes, and they do have some changes in some of their blood factors, factor 7, factor 10. Stasis in the lower extremities. Remember that DVT, you're going to be reading about as you go along, is a complication that we are concerned about, and this is really why. They also are concerned about DIC because of those blood factor changes. Remember, DIC is where they have a lot of bleeding, but then they also have a lot of clotting. Okay, they get the clotting first, and then they use up all of their clotting factors, and that contributes to the overwhelming bleeding that they get. You want to make sure that you're encouraging them to take daily walks, keep those legs moving. That, you know, the way that the blood goes through the veins is when the muscles are moving and they exert pressure on those veins, that keeps the blood moving. For respiratory system, remember, as they advance through their pregnancy, the fetus and the uterus can apply some pressure to that diaphragm. That can contribute to the woman being short of breath, maybe having some exertional dyspnea. If you think about it, they have all that weight facing forward, and as the baby is expanding and growing, it's definitely going to be, it puts pressure on the diaphragm, and it also puts pressure on the bladder. So this is the end of this recording. There will be another recording where we're going to be talking more about the physiologic psychosocial changes and also prenatal.